Hello everyone. Today we will talk about heart failure. I'm Dr. Li from the Cardiology Department of China Medical University. At the very first, let's talk about the definition of heart failure. Heart failure is the pathological process in which the systolic or diastolic function of the heart damaged. It is also a clinical syndrome which includes cardiac output decreasing, resulting in unable to meet the metabolic demands of the body. Next, let's talk about mechanism of heart failure. The mechanism of heart failure involves changing in cardiac function, neurohumoral system problem, systemic vascular function changing, blood volume changing, integration of cardiac and vascular changes. The change in cardiac function results in a decreased cardiac output, which results in from systolic or diastolic dysfunction, or a combination of the two. Systolic dysfunction is due to a loss in intrinsic contractility. Neurohumoral response include activation of sympathetic neural system and RAS system, and increased release of ADH and AMP. In general, neurohumoral response can be regarded as compensatory mechanism, but may also aggravate heart failure by increasing ventricular afterload. Increase in blood volume leads severs to increase ventricular preload and thereby enhance stroke volume by the Frank-Starling mechanism. There are other mechanisms which can cause heart failure. We will not discuss here. Next, let's talk about the causes which can lead to heart failure. First, several diseases which is primary myocardial disease, such as coronary heart disease, myocardial infarction, cardiomyopathy, which can decrease the output of the function of the heart. That is the main reason of heart failure. Second, there are other diseases which can increase the burden of the heart, such as hypertension, hyperthyroidism, and so on. Now, let's talk about the manifestations of heart failure. Manifestations include signs and symptoms. First, the low cardiac output can cause palpitation, pale or cyanosis, fatigue and weakness, and even shock. Next manifestation include congestion of systemic circulation, such as systemic venous congestion of hypertension, cardiac edema, hepatomegaly and hepatic dysfunction, gastrointestinal disorder. Other manifestations include the reason because of congestion of pulmonary circulation. For example, dyspnea on exertion, venous return increased, heart rate increased, and decreasing left ventricular filling. and so on. Thank you.